Good day to all the viewers at home, and welcome to a new thing brought to you by the Global Business Roundtable. My name is Sipho Mseleku, the convener of the Global Business Roundtable, and am your host for today. Today we'll be discussing a topic on child health care. Child health care. You know, there's different segments of society. There's men's health, there's women's health, and today we're focusing specifically on child health care. And we have in our studio experts, pediatricians who deal with these issues on a day-to-day basis, and they'll be able to advise us, parents who've got children, grandparents who've got grandchildren, as to how we deal with these issues when we confront them. I will introduce my panel, starting on my extreme right with Dr. Hendrik Kukemur. He's a pediatric registrar. And then immediately after him, I have Dr. Litabo Machaba-Simelane. She's also a pediatrician. On my left, I have Dr. Shalin Singh, a pediatric surgery. Welcome to you, Your Excellencies. Now, let me start with you. If you can just give us your highlights, what you do, and on a daily basis, and the highlights of your career, whatever you want to share with us. Your Excellency, Madam.
I am Dr. L. Machaba-Simelane. I currently also work with Dr. Kukemur at Joburg Gen, Baragwanath, but I also rotate through Rahima Musa Mother and Child Hospital. My job as well on a daily basis is a pediatrician. I recently qualified last year and also deal with pediatrics at a community level, at secondary level, and at a tertiary level.
Okay, we'll come back to that because we'll explain all these terms to the lay people out there.
My
Madam.
name is Dr. Shalin Singh. I work in pediatric surgery at the 2 academic hospitals in Johannesburg. We service a population of about 3.5 million children, and we operate on all parts of children. So anything that's wrong with them that can be fixed with surgery that isn't a bone, I'm your girl.
Thank you very much. So first, if we just get started with the questions, if you can describe what is a pediatrician and how does it differ from other specialists in the medical field, and how do they work with the general practitioners and other professionals, and how is child health defined, the child health care defined, and the difference between child health and adult health. What separates that? Health, isn't health just health? And why do we have a specialty on children? What are those things that affect children that don't affect adults? And I think in the typical causes, cases that we deal with on a day-to-day basis that affect children. So you can pick up any question and answer. Who wants to start? Should I start with you, Dr. You want, okay.
Yes,
Ladies first,
too.
okay?
Thank you. I would like to define what child health care is. It's not just a simple definition that we have for it. It's quite comprehensive. Child health care has, I could say, put it into about 4 components. First of all, it deals with health promotion, which is very important in our population, whether it's nationally and internationally. Secondly, child health is important in terms of preventative care as well, because we rely on many sectors, including government, to prevent certain illnesses in our communities. And henceforth, it's very important as well. The third that I would like to also include in the definition would be that child health is also involved in terms of cure. So many illnesses happen, which we do not want to happen, but in terms of child health, we have to come in and intervene and cure that. And then the fourth component that I would like to also introduce to the population is in the fourth one, which is rehabilitation. Child health now has to go and treat the ill effects, or what I could say complications of illnesses. So if I've given you all these 4 parameters that I've mentioned, you can agree that there's so many sectors involved, whether it's media in terms of health promotion, whether it's government in terms of resources, in terms of preventing healthcare, whether it's a lot of disciplines in terms of rehabilitation, where even the family plays a big role in terms of rehabilitating certain illnesses in the population.
No, thank you. Do you want to come in there, Dr. Kukuma?
So one of the questions is why pediatricians? So to put things into perspective, if you look at Grisani Baragwanath Hospital, on a monthly basis, there's about 1,500 babies that gets born. So that's about a high school a month, and that's in one hospital in South Africa, just associated with one city. Kids aren't just small adults, and that's something that one needs to realize, and that's emphasizes the need why there needs to be people like us who dedicate their lives towards the health and better will of children, and need to stand up for their rights, and that's why we're here.
Wow, thank you. We were all once children, and in one way or another needed, help from people like you, so that we could grow strong and play our role in society. You want to come in there, Dr. Singh?
So I must agree with Heinrich that children are not small adults, and it's very important that children are looked after by either people who have been trained in pediatrics or general practitioners who have been exposed to pediatrics. Also, when it comes to the surgical side of children, we operate very differently. Children heal differently. We operate with magnifying glasses and very tiny stitches. And a lot of the problems that the children have, they're born with. So we need to correct those abnormalities when they are very tiny. And when it comes to general practitioners, they are the people who have first contact with the children. In our population, it's usually the local clinic where there may not even be a doctor. So our nurses are very, very important to us because they are the safe place where we send our children back to. We cannot look after them for the rest of their lives. There are just too many of them. So we send them off into the world with a little note saying, kindly do a dressing or check a weight. And we really do rely on the community nurses to help us a lot.
Thank you. Do you want to add any other point on those two? And your views on what are the typical cases that you deal with that affect children, and your views on homeopathic treatments in relation to children, and I think that would help us to know.
Being in South Africa, which is mainly a developing country, we are often sometimes termed to be in between developing and a developed country, meaning that underdeveloped, we don't have too many resources. We deal mainly with infections. That is our main ones. They have a mortality rate for under 5. And at the top 5, the ones that are documented, most of them are also infections. So we deal with a lot of what we call lower respiratory tract infections, which is chest infections, whether those caused by viruses or by bacteria. And then also in the infections, we have diarrhea, which is also competing in that competition. We've got malaria as being part of sub-Saharan Africa. And we also still have measles as well. So I know I was working at the Baragwanath POPD the past 2 months, and we even got a national report to say that we've got a measles outbreak. So which means that in terms of our vaccination program, which we will talk about, it brings those type of issues. So also not forgetting childhood injuries, which I'm sure Dr. Singh will have more to talk about there. So those are the common things that we see mainly in our clinics and at a primary level, which then if they get complicated, they go to secondary hospitals. If become more complicated, including other stuff, also go to tertiary level as well.
Okay. No, thank you. I think that was quite useful background to what you do on a day-to-day basis as pediatrician. If we are to proceed with the questions, how common are child burns victims, and how can we minimize or prevent these on children? And what are the latest trends in immunization? And what are the basic immunizations as a child needs to get? What are the basic that parents need to be exposed to? And what are the risks if children do not get this immunization early in time? How can caregivers detect early that their children might be susceptible to having chronic conditions such as ADD, autism, diabetes, ADHD, and other related chronic conditions? And how does the public healthcare system take care of a child healthcare? And how is this different from the private sector healthcare system? So anyhow, who wants to start?
Okay, so burns are very common in our environment. Our children are living in homes that may only have one room, where the kitchen is also the bedroom and the TV room, and also the place where we boil water for baths. So we probably admit about 500 burnt children into our burns ward per year in Chris Hani Baragwanath Hospital, so that's just in one hospital, and we see about 1,000 others as outpatients. So it really is a large number of children that are getting burnt. Most of them are burnt by hot water, and then a smaller percentage by flame.
Okay, which one you want to answer?
Yeah, okay, so I'll take the question on the immunizations. What's the trend in immunizations at the moment? And it is very important. I think that's the one thing that one needs to realize, is that it's an entity that's really important. It's very, very important for public health. Now, it's sort of made easy for new parents, because you wonder, when do you need to take your child for immunization and how do you do it? But every child that's born in our hospitals gets a Road to Health card. And in that card, it indicates as to when you need to go to a clinic setting to get the immunization done. Why is it important? As Letabo said earlier on, there was notice of a measles outbreak not too long ago, even a chickenpox outbreak in the West Rand. We hear news the whole time in Europe at the moment. There's problems with measles as well. President Donald Trump is against immunization of some sorts, but that's also very dangerous, and they will find that out if it should go through that children should not be immunized. And we really need to be aware of it. It's something that we see on a daily basis at our hospitals as well. Children that come in that are sick, lots of children do not get immunized. It's due to a lot of reasons. Some of it is because of access to clinics. Some of it is because of knowledge. Some children get born at homes where people are not aware that they need to immunize their children. But we got to use this opportunity to let everyone know that it's something that you need to do. It's something that you owe your child and everyone around them. There's an entity called herd immunity. So we all get protected against a certain disease, for instance, measles. But if children don't get immunized, we lose the herd immunity, and that means more and more people will get sick. So what type of immunizations are there? If we start at birth, there's immunization against TB, and it's really important. It protects our children against disseminated TB. So disseminated TB means widespread TB. It's one of the severest forms that you can get. And in our communities, we've got a high incidence of tuberculosis. And it's something that one needs to be aware of. It goes along with HIV. And that's also something that we really need to be aware of, and something that's really important. As adults, we need to test ourselves. We need to be aware of what we're doing. As mothers, if we know we're HIV positive, we need to make sure that we're testing our children as well after birth, and be aware on how we can help our children. Because these days, HIV is not a death sentence anymore. You can live a full, healthy life. It's just to be aware. And we've got programs in place as part of the Department of Health called PMTCT. It's prevention of mother to child. And that's a program that's working, and it's doing wonders with HIV care in our babies. Other important immunizations that children receive is pneumococcal vaccinations. And that's made a big impact. If you look at the common diseases in children, like Lutaba was saying, at your lung infections, the pneumonias, your middle ear infections, meningitis, those are important things, and it kills children. But you can immunize against it, and lots of lives are saved. And it's been proven. It works. It's something that we need to do.
We were all immunized when we were young at schools. I remember from primary schools, nurses would come, get injections, would be given sweets, but after that we're safe for a long time. You know?
Exactly.
So prevention is always better than cure.
Thank you. Yeah.
You wanted to respond on which one?
So I'm going to answer the one on how does public healthcare systems take care of child health care,
Yes.
and in comparison to the private healthcare system.
Yes.
So in terms of our public system, it's got an immense and challenging task to do, because with the public, we're dealing with populations, huge populations of children, and not just in one province, but in many provinces. So in terms of that, that's why I initially introduced earlier in terms of primary, secondary, and tertiary. In terms of the population and at community level, we need health staff, meaning doctors, nurses, and allied sciences, physios, and social workers at the community to meet the demands of the people when they come into first contact. So that's how our government has currently developed the system. There's still a lot of things that still need to be enhanced, but at the moment they've started there. And then when you move on to secondary hospitals, you get a little bit more. That's where Dr. Singh, the surgeons, can come in, not at pediatric level, maybe more general surgeons come in there to try and give that need. And then when you move to tertiary, then you start getting super specialized specialists, even at quaternary hospitals, where you get pediatric surgeons, hem-oncologists, and you get so many varieties of specialists. So meaning that in the public sector, for somebody to be able to get a specialist or a super specialist, they need to go through all those levels, which that differs quite significantly from the private, where private, it's almost like the haves, and the public, they don't have. In public, for those of us in medical options, good medical aid options, we can access a super specialist immediately.
Easy,
If you need a high-tech investigation like an MRI scan, if I go today or tomorrow, I can access it. But in terms of public, our children have to wait. And remember, there are some diseases which cannot allow you to wait.
Yes.
If a child has a liver cancer or a nephroblastoma, meaning a kidney cancer, kidney problem, you need to intervene as quickly as you can.
Possible.
But because our public sector is dealing with humongous populations, they are at the mercy of government, unfortunately.
The shortage of doctors.
The shortage of doctors, the facilities are not great, yes, and finances, sometimes in the beginning of a new financial year, there's lots. Halfway through, there's nothing left because of resources and So that's the big difference in South Africa.
Wow.
If I can just add on that, when it comes to pediatric surgeons, there are very few of us in South Africa and in the world, actually. So we have to service the public and the private sector, which means that the public sector probably suffers because of there being so few of us. We must try and service all the communities. All the babies are crying, all the nurses are waiting for us, all the casualties are calling. We really are stretched into a million different places.
But government need to intervene in terms of that and ensure that they train more doctors so that they can meet the demand, especially in the public sector.
Absolutely, they need to stop freezing our posts and, you know.
I agree. We are talking about child health care. What is available out there and how parents can detect and get help to ensure that their children grow to be strong and well-abled ladies and gentlemen and to contribute in society. So we're going to open this segment to questions from our audience that are going to ask our panelists whatever questions they have. Who wants to start? Yes, sir. Introduce yourself and then ask a question.
Docteur Pierre Ngomat du Gabon,
Dr. Biangomat from Gabon,
envoyé spécial du chairman dans le monde entier.
special convoy from JBRT to the entire world,
Administrateur, directeur général de Housing Africa Management.
general administrator of the housing management.
Nous avons apprécié tout ce que vous avez dit tout à l'heure,
We've appreciated everything that you've said just now,
mais on a un souci par rapport aux petits-enfants.
but we have a concern towards the little children.
Comment vous faites pour découvrir leur maladie? Parce que les enfants ne s'expriment que par les pleurs.
How do you, what do you do to detect illnesses? Because children can only express themselves through crying.
Une grande personne, quand elle est malade, elle vous dit « j'ai mal ici, j'ai mal là,
An
j'ai mal
adult can
derrière.
easily tell you where they feel the pain,
Mais un enfant ne vous indique pas le lieu où il est malade.
but a child does not tell you
Ils
where they are
pleurent.
sick. They just cry.
Et vous faites comment à la fin?
So how do you do it in the end?
Je vous remercie.
I thank you.
Thank you. The next question.
Oui, on m'appelle
My name is
Valet Chobo,
Valerie Chobo.
député à l'Assemblée nationale.
I'm an MP in the National Assembly.
Je viens du Bénin.
I'm from Benin.
Ma question a trait à ce que mon prédécesseur a dit,
My question is similar to what my predecessor just asked,
mais je veux le préciser, ça concerne les traitements préventifs des enfants.
but it precisely concerns preventative measures for children.
Un enfant de 1 jour à 6 à 9 mois qui commence par marcher,
A newborn up to about 6 to 9 months who starts walking,
il essaie de commencer par se lever un peu là.
he tries by standing.
Il voit n'importe quoi, il veut inhaler, il veut mettre ça dans la bouche. la
Everything he
pousser partout.
sees, he wants to sniff in, he wants to put in the mouth.
Ma question, elle est celle-ci. Quel traitement préventif on peut administrer à ces gens d'enfants?
My question is, what preventative measures can we administer to these children?
Parce que ça fait mal que l'enfant qui ne peut parler, subitement, c'est des crises qu'il subissent et ça fait
Because
vraiment mal.
it's very sad to see a child that cannot speak immediately falling ill.
Quelle prévention faut-il avoir?
What prevention can we have?
Merci.
Thank you. Any other questions? Oh, we've got a comment from at the back.
Good evening, Your Excellencies and the panelists again. Thank you very much. I'm Dr. Thabiso. I work both part-time in private and in public sector as a senior medical officer and also as a senior psychiatry doctor. Thank you very much to the panelists. You've really given us a very clear, detailed, and simplified version of what happens in pediatrics child health. And I think to our viewers, this is amazing because doctors are known to speak the language that nobody can understand. Thank you for that. 2 comments and maybe some addition in the intervention. We know that ADHD is a serious problem and it is underdiagnosed. Not because doctors don't know how to diagnose it, but mainly because of the stigma and what comes with it. How is pediatrics making sure that this is changing? Because we know that the worst thing that can happen, an untreated ADHD later as a teenager and later, these are the reasons we've got lots of addictions, alcohol, drugs, etc. That's 1. 2, NHI. Personally, I've got the experience of NHI because I've worked in New Zealand and I promote it. I say NHI works. But as the doctors who are in the public sector and at a specialized level, how are you able to impact and make sure that NHI works? Thank you very much.
Thank you. The last comment in 1 minute.
Thank you, Chairperson. My name is Manti Mediale. I practice mainly at the primary level, and my question is very simple. I just want to know your experience as working in tertiary and quaternary institutions. What's your take on malnutrition, on kwashiorkor and marasmus, and what are the incidences, and how can we prevent it? Because we believe strongly that prevention is better than cure. And before they get to you, what are the referral routes that we can take? Thanks.
Thank you very much for the comments and the very specific questions. Now we come back to our panelists and take responses. Who wants to start?
Okay, I'll start.
Okay.
I'll start by responding on the first two questions. That's true. It is a challenge, and that's why children aren't adults. That's why we're doing what we do. That's why we spend all the years in training and trying to get to know children, trying to get to know development of children. If you look how we try to make it easier for the community, so if you look at the Road to Health cards, our clinic cards, in the back of them there's a guidance on how children need to develop, at what time in their life they need to be able to do certain things. And this gets emphasized at the clinic visits that they go to, and this also at the same time when they go to the clinic visits for the immunizations. So we try and do all of these things together. To one, make sure they do get the immunizations. Two, make sure we pick up on problems that are starting and that one can address whilst they still are small.
Thank you. Do you want to come in?
Yes, so I would like to first answer the question on nutrition. In South Africa, unfortunately, we still see a lot of nutritional problems. We're experiencing almost like a two-barrel problem, where you're getting your undernourished children. So we would formerly call them marasmus and kwashiorkor, although now our World Health Organization has newer definitions, where we use moderate, mild, and severe, where you use severely underweight for age, and so forth. And then on the other hand, we're getting like the fast food generation, where our children are getting exposed to fast foods, high sugars, high carbs, high fats. So we're getting lifestyle diseases, which you are only supposed to get at adult level. Just recently, last month, we diagnosed an 8-year-old with type 2 diabetes. Type 2 diabetes, when we study, is by definition an adult onset disease. But because of the lifestyles that these children are undertaking, they are also experiencing that. At tertiary level or at quaternary level, if we go to Joburg Gen, we should not be seeing nutritional cases. So your children who are marasmic come all wasted, frail, they are hungry, dehydrated, and those children really need extensive management and more rehabilitation than cure. So what happens with us now is initially we were taking in a lot of them at tertiary and quaternary level. And the route that you would need to take is a doctor would have to see them in the clinics, and then they write a referral to us. We were admitting them because we found that most of them do die. And also to treat them, you need a whole lot of multidisciplinary teams. You need physios, you need OTs, you need the neurodevelopmental team, because if a child is not eating, the brain doesn't develop. So now we were struggling to keep up with the burden of admitting most of them. So what happens is most of them, we actually treat them, just even in the clinics, and refer them back to the clinics because we are not coping with the load. And only the very sick ones, so they need to be, they need to have, for example, kwashiorkor and marasmus and something else for us to keep them in hospital. Otherwise, there's been many developments now with the ready-to-use foods that have been distributed to the clinics. So it's a packet of food with a lot of nutrition, a lot of energy, a lot of what the child needs, which have been given to the clinics to give out to the children. In South Africa, we are not practicing it quite well, as opposed to other African countries like Uganda. Because in South Africa, as I say, now we're having a population who they might not eat healthy, but they're eating a lot of junk, if I can use the word, lots of sugars. So I hope I've answered your question.
No, thank you very much. I think you've answered that extensively. Dr. Singh, let's start with you just to respond to some of the questions that they've asked.
All right, so how do we do it? We train long and hard, like any sports person, like any actor, Olympian. We spend hours and hours and hours practicing our craft. So we work about 100 hours a week just with our children every day, learning how they respond, learning how to examine them. It's not only you that wonders how we do it. The adult doctors, the adult surgeons call us vets because they say that our patients are like puppies, seeing as they can't talk to us. But if I examine a newborn baby while breastfeeding, that child is happy as Larry. You can touch them wherever you like. They will not make a sound unless there's pain somewhere. The mom will often come and give you the child's symptoms. We listen to mommy. Mommy knows baby better than anybody else in the world. So that's how we do it. How do you access us? We have an open door policy at both Charlotte Maxeke and Chris Hani Baragwanath hospitals. Our clinics are open to anybody. You can have a referral letter from a nurse to come in. There's no maximum number of patients. As long as there are children, we will see them in our clinics. And we are there 24 hours a day. There are 1 or 2 doctors on call for pediatric surgery every single day of the year. So that's how you access us. There was another question that I wanted to answer, which I can't remember. Oh, prevention. You asked about prevention. So for burns, I would crawl around my house and see, what can my baby see? What can my baby get to? What can they touch? Cover all the plugs. Pick up anything small off the floor. Never ever give small children money. They will swallow it, as you said. Be careful with earrings that they can take out. They will inhale them. When it comes to hot water burns, you just have to give up the idea that you're going to have a tablecloth in your house, because as they start cruising around, they hold on to whatever is around them. They pull on the tablecloth, whatever's on the table lands on them. Kettle cords are another big culprit. You need to make sure that the cords of the kettles are not hanging over the side of the counter, that they're in pot handles as well. If you can, keep your children out of the kitchen when you're cooking for them. Put cold water into the bath first, never hot water. So then you never have a bath of hot water lying around in the house. Those are the things that you can do to prevent these things from happening to your children.
Excellent tips. Dr. Kukemuru, if you can come in on the issue of early detection of issues like ADD, ADHD, you know, and all other related potential chronic.
Just one more thing on what Shalin was saying. Another important entity that we see a lot is children drinking paraffin. And it all comes down to, we understand it's thrive in the communities, and that's an element that gets used to make food, to make heat. It comes in the way that it's stored. So one shouldn't store it in your fridge in a Coke bottle. It shouldn't be stored in any cool drink bottle. It should be stored in something that's marked as dangerous. That's something to be aware of, and we see that often, and children do die of it. Coming to chronic diseases, something like ADHD, it's one of the most common psychological disorders in children. If you look at the global incidences, about 3 to 5% of children in the world suffer from ADHD. It is relatively difficult to diagnose ADHD in a child, especially if they're younger than 5, because kids are kids. How do you know that the child is not just being himself, being naughty or playing? Sometimes they can't control the impulses. The impact this has on the development of the child is major. If you have a child who constantly gets told that he's being naughty, he doesn't know what to do, he needs to sit in the corner, he needs to keep quiet, and he actually can't control these things, it impacts his whole development and his future. Like the doctor in the audience was saying, addictions later on in life. It's a big problem. Now, how does one detect it? That's a good question. It comes along with all the chronic diseases. So one needs to keep a close eye on the development of your child. How do you do that? And that's, again, I reiterate, by doing clinic visits. One can compare with other children that's the same age of your child, see how they are, where they are in life, how they're developing. If they're going to creche, if they're going to a primary school, how are they performing in the class? How compared to other children, and what's their mood? How do they feel after a day? what can one do? You know, if you get diagnosed with ADHD, there are different modalities to treat it. So the one is a non-medicine way, and that's how one should start. And even from a young age, if you've got a child and you think it's a problem child, what can one do? What can one change in the house, in the lifestyle? So there are two important things. The one is the diet that the child follows, and Lataba was also touching on that. So high sugar contents in diet can cause a child to be overly active or irritable or inattentive, and that can mask as him being a child with ADHD. The other important thing is, so you need to follow a balanced diet. The other important entity to remember is sleep patterns. So we live in an era that's technology rich. So everyone's got access to telephones, everyone's got access to televisions, widespread. Wherever you go, it's there. But it's important to remember the importance of sleep and a healthy approach to that. And so by bringing that into context, one should not allow children to watch TV late into night. It influences your sleep patterns. One needs to be aware that a child needs to sleep. It differs on the age of the child. The older they get, the less sleep they need, but we all need to sleep. And even as adults, we can feel it. If we get a good night's rest, then the next day we can perform adequately and we can do what we need to do. As a child, you've got a lot of stress. You've got a lot of pressure to perform. You need to reach all sorts of levels of development, and there's all sorts of everyone's looking at you and expecting you to do something great with your life. Yeah. And we need to empower children to do that. So we need to help them. So the way to do it is having a secure family life, making sure they go to the clinics, dealing with illnesses as they come along. When do you know that a sickness is a problem? So most of illnesses in children, especially below the age of 5, is due to viral causes, if we're looking at infective diseases. And these things, they run their own course, so you don't necessarily need to do something about it. But usually the time frame is about 72 hours, and then one should start feeling better. If you don't get better after that time, then you should seek help.
Yeah.
And that's the important message, I think, to take home.
Thank you very much. I'm left with 2 minutes. I want to give you 1 minute to give your final advice to the viewers at home, and your 1 minute to give final advice to if there is one thing that they must remember, what is it? If you can just give them in 1 minute.
Yeah, my advice to mainly the parents, looking at the fact that our children cannot talk for themselves. Child health care focuses on the mother and the child, and in some cases the father and the child. So I would advise the mothers to take themselves seriously. You are the first doctor to that patient. You know your child better than anyone, and I think Dr. Singh also touched on it. So if you see something outside the normal, you come and tell us. If you cannot convince somebody, you move on to another level and you find somebody who's willing to listen to you.
Wow. Thank you very much. You are the first doctor to your child. You have to pick up any symptom that's not normal before the doctors themselves. Your final word of advice?
Would be to try and see the world through the eyes of your child. Look for things that might be dangerous. Look for things that are multicolored and beautiful and shiny and may actually be dangerous to your child.
Wow, wow, wow. Thank you very much, and I think it was a powerful session. You fed our viewers and all of us here, even the audiences, the studio, with a lot of information, a lot of advice. We're taking home wisdom to practice so that we can be better. We also want to thank the audience for questions and inputs that they've made. And to you, the viewers at home, we thank you very much for tuning in. If you have any questions or input or comments, check us on our website. It's www.globalbusinessroundtable.com. You can also send us an email and at comments@anewthing.tv. Comments@anewthing.tv. Remember at all times to seek first the kingdom of God and his righteousness, and all these things shall be added unto you. That's Matthew 6, verse 33. See you again next time, and God bless.